Check. Mic check. Good morning, good afternoon, good evening. This is Dr. Garais, BIO111, Anatomy and Physiology 1. And this is the take 2 version of chapter 1 video that I was trying to make. So let me bring it up. And again, this is a summary video. It's not meant to be a replacement for the actual lecture. So I hope you made it to lecture because there are insights in the actual lecture, and I know I do story time a lot, but the stories will mimic clinical vignettes and clinical situations that you may see that are similar to what you would see on a quiz or an exam. So this is just straight up lecture. So I have it right here, and let me just get through the salient features. Okay, I think I got it backwards. Hold it up. Yeah, it's just going to do it this way. Okay, so we can do it this way. So over here a little bit. So the origins and history of anatomy and physiology are not important, but definitely the terms. Anatomy, physiology, know those terms, the parts, and of course how the parts work together. And another term is pathology, which is logi, study of patho, which is disease or the abnormal conditions. Anatomy and physiology are normal conditions, the rule. Al pertaining to norm, the rule. Now, remember, anatomy and physiology, we discuss them in separate terms, but they're related. If one is damaged, and the other one will be affected. So if a part is damaged, the functioning of the part will also show signs and symptoms of abnormality, and vice versa. Levels of organization. Know all the examples of all these levels. Subatomic particles are smaller than the atom. That's your neutron, proton, and electron. Then, of course, example of atom is hydrogen and carbon. Example of molecules is water and glucose. Glucose is C6H12O6. Water is H2O. Macromolecules, I want you to think DNA, proteins, carbohydrates, all the ones in our first lecture that we talked about. Of course, cells, those are the specific cells, and we're going to expand upon that. A bunch of cells that are glued together form tissues. Tissues make an organ get grouped together in things called systems. And of course, all of that makes an entire organism, which is the whole human being. Know the terms of the characteristics of life. Growth versus development. Growth is the increased number and size of cells. Development is, we'll talk more about that in week 5. So reproduction is, of course, means to go back and to copy. So production of new cells. Responsiveness, any reaction to change, and that's homeostasis, right? And of course, movement is actual physical movement, can either be external, as in body position or location, or internal in the motion of your internal organs, most likely, respiratory, cardiovascular, and digestive. Metabolism is the sum of all chemical reactions in a living system, and it produces energy and it builds up. So catabolism, the two chemical reactions, and we're going to be talking about them in other chapters as well. So metabolism is the overall sum. So what are the two parts of metabolism? The two parts are anabolism. Ana means parts. So I want you to think ana, parts. You want bol means growth. So you're building. And catabolism is the exact opposite, is the breakdown of things. And these two things may seem like opposites, but they're going on at the same time in your body. There's parts of your body that's going to be breaking down things, and there's going to be parts of your body that's going to be building up things. The sum of these breaking down and building up reactions, chemical reactions, is called metabolism. So anabolism plus catabolism, metabolism. Respiration, I want you to think gas exchange, and the two gases in question are O2, which is oxygen, and CO2, which is carbon dioxide. CO2 is written like this, C, capital O, with a little 2 like this. And of course, oxygen is O2. So, digestion is the breakdown of food into usable nutrients for absorption in the blood, and it goes along with metabolism or catabolism, and that's your digestive system. Circulation, of course, the cardiovascular system. You want to move things, right, throughout your body, and of course, excretion is waste, okay? And anything that's extra in your body is considered waste. Here are the three requirements. Well, there's more requirements. There's actually 5 requirements for water, food, oxygen, heat, and pressure. But the first 3 are water, food, and oxygen, and of course, water. It is the most abundant. You need it for all metabolic processes because they are in an aqueous environment. Transport of substances, and also regulation of body temperature. Human beings require homeostasis of a body temperature of 98.6 degrees Fahrenheit, also known as 37 degrees Celsius. Now, the next one is heat. I want you to think of heat as not only a measurement of just energy, it's a measurement of the amount of energy you put into a system and also the amount of energy that you take out of the system. And in human beings, there must be a balance. Energy in equals energy out. The same thing with intake in and outtake has to equal each other. Again, all back to the term we learned in lecture, homeostasis. You want to keep the body homeo, in the same, stasis meaning to stand in one place. Pressure is the application of any force on an object, force is essentially the definition of any work pushed through some distance. So atmospheric pressure, I want you to think about respiration, gas exchange, breathing, okay? There's gradients of pressure between high and low pressure, between the outside world, your atmospheric pressure, and the inside pressure of your lungs, and that's how we're gonna be discussing in the respiratory lecture, that's how you breathe, and I believe that's next term. Hydrostatic pressure, hydro means water, and stasis, we already know, means to stand in one place. So hydrostatic pressure is blood flow, but the blood flow going in must equal the blood flow going out. A typical 70-kilogram male starts off with 5 to 6 liters of blood in the morning, and it should end up with 5 to 6 liters of blood. Homeostasis, there are 3 parts of homeostasis, the receptor, control center, and your effector. Now, let's look at the picture. The receptor, of course, responds to a stimulus. So it's some sort of energy, and I'm gonna put a big E for energy. That's what your receptors do. For example, your thermoreceptors in your skin, all they sense is either the heat or lack of heat in the air or in the room. Now that's going up to a bunch of nerves that are going up. So that's your ascending fibers. And this is your sensory pathway. And we're also going to learn there's another word for it as well, is afferent. But let's just go sensory, let's call it ascending fibers. And then of course, your control center, which is your brain, it controls the set point. It controls what your body is going to consider normal or consider the rule or the range, okay? And then, of course, your effector, which is a descending pathway or descending set of nerves, also known as your effectors, because it's going to affect some sort of change. And then it stops the process through negative feedback. So I'm going to draw a little negative sign here. So, sensory ascending fibers. Receptors are structures in the human body, anatomy in the human body, that pick up energy from the outside world. So, for example, your eyes don't really see anything. The retina in your eye is the receptor that just picks up light, and the light gets converted into electricity. It goes into the nerve, and then your brain is the one that's going to figure out what to do. So, for example, you see a truck coming. What's it going to tell your muscles or your effector or your muscular pathway, right? Or the motor pathway. Let's write that word. This is sensory going up, motor coming down. So that's your motor pathway, or your descending fibers, also known as your efferent or effector pathway. And negative feedback is what stops this process from getting out of hand. So negative feedback, think of it like brakes, okay? We don't want sudden severe changes. Your body likes moving in little baby steps. And the way we can do that is to slowly, it's like riding the brake. And what are some classic examples is body temperature, blood pressure, and glucose level. So when we look at this, let's say, for example, your skin receptors start sensing that you're cold, right? Your control center or your set point, which is your brain, now realizes and interprets the signals like, hey, it's cold. And what will then happen? Then there'll be a signal to the motor system or the descending pathway, and you'll start to shiver, or you'll get up and wear a jacket, or move to another room that's maybe warmer. And then, of course, when you're already warm, there's negative feedback that stops this whole process so you don't get out of hand. And that's negative feedback. Body temperature, blood pressure, glucose level, your classics. And this is what happens in 99% of the homeostasis, homeostasis that goes on in your body on a daily and actually minute-to-minute basis. Now, what's positive feedback? Positive feedback is the exact opposite of brakes. It's an accelerator, right? Positive feedback is telling your body, keep on going, and it goes, and you start out slow, but keep on going, and it'll just ramp up until infinity. But there's ways of stopping positive feedback as well. But the only two examples that I want you to know about positive feedback is blood clotting, because of course you'll keep on clotting your blood even long after you stop losing blood, but it's still, your body still wants to make sure you don't lose any more. And of course, the more classic example of positive feedback is the uterine contractions of childbirth, also known as the uterine contractions of parturition. No axial versus appendicular, and it's a little bit more important when we start talking about the skeletal systems. Your head, neck, and trunk are axial portions of your body, and your upper and lower limbs are appendicular portions. Know the next slide as well. Your major body cavities. There's two posterior body cavities. Up in the superior posterior region of your skull, that's your cranial cavity, which is adjacent and connected to your vertebral cavity or canal here. And those are posterior. The three anterior chambers or anterior body cavities are your thoracic, abdominal, and pelvic. And notice that the abdomen and your pelvis are both connected, hence the term abdominal pelvic. A beautiful both A and B question, and they're both located in the anterior portion of the body. I failed to mention this, but we kind of mentioned it when we were talking about the pleural cavity, which is the coverings of the lungs, and the pericardial cavity, which is here, which is covering of the heart. The heart is located in the middle section here of your thoracic cavity here, called your mediastinum. Your thoracic cavity is bordered inferiorly by your diaphragm muscle here, but you could see the abdominal and pelvic cavity are contiguous with each other. So whatever affects the pelvic cavity will most likely or eventually affect the abdominal cavity and vice versa. Oral, nasal, orbital cavities, and middle ear, these cavities and these spaces in your skull, we're gonna talk more about them when we talk about special senses, and also next term when we talk about the respiratory system. Know your three abdominal pelvic membranes, which is your pleura, pericardium, and peritoneum. The pleura, of course, covers the lungs, pericardium, the heart, and your peritoneum, your abdominal pelvic organs. There is a visceral and parietal layer. The visceral is the innermost layer, which covers the organ directly, and the parietal layer is the outer layer, which lines the cavity, the wall of cavity. In between the visceral and parietal layer is the serous fluid, which is its function is for lubrication between these two layers. The visceral layer is the deeper layer, and the parietal layer is the outer, more protective layer. Here is another view of this is transverse section, and you can see a nice little cross section. Here's the anterior or front of my patient, and of course your spinal cord and your vertebral column here located in the posterior portion of the patient. You will notice that all the pleura here and the pericardium are double lined with that potential space in between, and that's where the serous fluid or the lubrication fluid is located. You'll also notice here, I was going to mention it later, but I might as well mention it now since I'm here. Arteries are typically colored red to connote that they're oxygenated. Veins are typically colored blue in textbooks to connote that they're deoxygenated, meaning they're carrying more carbon dioxide than oxygen. And yellow is the universal color for fat or adipose tissue. Now, in real life, your arteries and veins aren't red and blue, and you don't have red and blue blood. And also, your fat isn't really like bright yellow. It's more like if you took a good look at the walls in the classroom, they're kind of like it's like a milky yellow. It's a very light yellow. Now, these colors in anatomy and physiology and in typical anatomy textbooks, they're called conventions. They're just the colors that if you use yellow, it already connotes fat. Red, it's an artery, and blue, it's got to be a vein. I forgot to mention that. Know your systems. Integumentary system, of course, it's your skin, body coverings, protection. Know and understand it also has temperature regulation. Of course, your skin, you sense, you can feel things, not only feel temperature, thermal regulation. Also, your skin through produces vitamin D, which is very important in calcium homeostasis. We mentioned that in lecture. Skeletal and muscular system, I want you to think movement, protection. But with the skeletal system, add hematopoiesis, which is the production of blood cells. Let's write that word down. It's a 25-cent word. That's a little bit important at this juncture. So the production of red blood cells, that term is called hematopoiesis. Oh, look at me, I can spell. And that is poiesis. That is the production of blood cells, and that happens in the skeletal system. Like the story I told you about the little girl with leukemia, if she has a blood problem, she's also going to have a bone problem. Nervous system, endocrine system. The nervous system, they're both systems of communication. Both nervous system uses electricity, and they use chemicals called neurotransmitters. The thing about the nervous system is it's rapid, short-term effects. A good way to know this is if I poke you in the eye, when do you feel it? You feel it right now. But if I stop poking you in the eye, you should stop feeling it. Now, in the endocrine system, it takes longer because they don't deal with electricity or neurotransmitters. They'll deal with chemicals called, well, the proteins. They're called hormones. They're slower, but they have longer lasting effects. Classic example, growth hormone. Another classic example is insulin and glucagon. We're going to talk more about that in class. Cardiovascular system, lymphatic system, straightforward, and they're together because they both transport fluid around. And the lymphatic system transports lymph fluid, which helps take away excess water and excess fat from the cardiovascular system, and also even from the digestive system as well. So lymphatic system, I want you to also think immune function, right, which is this part down here, and of course transportation of fluids. And both of them do transportation of fluids, so that looks like a beautiful both A and B question. Digestive, of course, self-explanatory. Respiratory, remember gas exchange is always between oxygen and carbon dioxide. And the urinary system, I want you to think excretion. And excretion of what? Water. And it's going to mess with blood pressure but more details to come. Just think urinary, excretion, a lot of it water. Reproductive system, of course, male and female sex systems. Nice to know. Anatomic position, know what it looks like, but what's more important, know the terms. Know proximal versus distal, medial versus lateral, a right versus left, anterior versus posterior, ventral versus dorsal. Know your three planes or your three body selections, three body planes. You have your sagittal, also known as your mid-sagittal, which divides your body equally into a left and right. Transverse or horizontal section divides your body into a superior or inferior portion, and that's this one, transverse, right across the middle. And the coronal, also known as frontal section, that's going to chop you into front and back. Why does this guy look like David Goggins to me? All right. If you don't know what it is, Google it. That guy's completely insane. Here's another view of it. Cross section, oblique, transverse, nice to know. There's other terms and there's other things that are a little bit more important. Know your abdominal regions. I will not ask an RUQ, LUQ question here on the right. I'll ask what? A question based on this, on the 9 boxes, not the 4. All right, that is your quick. Oh, well, you know what? Since I'm already here, let's talk about this. Okay. Start looking. You can practice this by taking a scrap piece of paper, just making a tic-tac-toe box, and then ask yourself, remember, what's the middle story? Umbilical region, because that's my umbilical. What's the prefix that means right on top of? Epi. Epigastric, so epi means right on top of something. That's why your epithelial cells are your top layers of your skin cells. But the epigastric region is on top of the umbilical region, and your umbilical region is your belly button. And of course, where's your pubic bone? It's right here. This is a piece of cartilage here called your pubic symphysis, and your pubic hair should be in this region. So you have epigastric, umbilical, pubic. Now you have right and left. Right hypochondriac area, which is hypo, underneath the ribs, chondriac. Right, lateral, meaning the side. Another term for right and left lateral region is lumbar, Lumbar. Let's write that down. Lumbar, excuse me. Need one of my cat naps. Lumbar, also known as lateral, and of course your right inguinal area down here. Okay, so you can look it up. There's a lot of really cool things online that can help you practice this. And what do? I can put A, B, C, D, E, F, G, and you tell me where's what. All right, and I think that's it. All right, I'll see you guys in class.